Good afternoon. Great to see you all again. Delighted to be back, surviving my second day in the lovely state of Gujarat. Fueled. We had a lovely meal last night. I thought we were going to get taken to a fantastic Gujarati restaurant, but we got taken to an Italian restaurant. But it was lovely anyway. It was great food, and we have great singing. I didn't realise that maxillofacial surgeons have dual roles. We've got Amit, and we've got Sonal and Mustafa all were serenading us last night, so it was fantastic. So Sonal gave me a lecture. She says, "Andy," I said, "Yeah." I said, "I want you to be inspirational." "Okay, try and do that. "And I want you to leave a legacy." I said, "Well, I tend to do that everywhere I go in India." So she asked me to think about UK perspective of oral and maxillofacial surgery. And I thought, okay, where do we start? Well, you've got to start in the beginning, really, as anything. And this is where maxillofacial surgery really started off. Harold Gillies was a plastic surgeon, he's Australian, and we all know him from his instrumentations and stuff like that. So these poor chaps in the First World War were coming back badly disfigured, badly burnt, and there was no way of treating them. But Gillies and his crew developed a number of techniques to help with facial reconstruction, and I think that's where the sort of maxillofacial surgery was really born in the way of reconstruction, trauma, and thinking about what we're thinking about over the last couple of days and the next few days is incisions and how to get into it. It was taken over actually by one of his actually family, Archibald McIndoe. He is also a plastic surgeon, and he started treating airmen in the Second World War and set up units, East Grinstead, Roehampton, and they called the Guinea Pig Club because a lot of these guys were guinea pigs. They were doing operations on them that they hadn't done before, and they mastered things like, you can see there, the tube pedicle flap, which was one of the first sort of reconstructive matters that we had to be able to help support people who had, you know, partial avulsion of maxillas, noses and burns, basically. So then, you know, there was a huge amount of ballistic trauma that was going on. You can see these badly deformed soldiers and airmen, basically. The techniques were actually quite rudimentary. You can see we had pedicle flaps, but you can see plaster of Paris head caps on there. We were using wires and we were using all sorts of things basically to try and reconstruct. Then the sort of specialty of oral surgery, well, we're actually known as hospital dental surgeons rather than oral surgeons. Oral surgeons weren't around. And these guys, again, Ben Fickling, if you heard of Fickling's forceps, they all seem to get instruments named after them. I'm still waiting on an instrument being named after me. There might be an Edwards retractor someday. Sir Paul Bramley and Gordon and Hardman, and these guys were really the sort of real starters of what we call oral surgery. Again, they were fixing fractures with wires. You can see there a Royal Berkshire halo. You can see the use of mule pins, taller pins, a Levant frame. They were using these, but these were sort of pioneers at the time. And then books started coming out. You can see there Kay and Kelly's book, Fractures of the Mandible. I remember reading that book when I first started, and some of you here may well still read that book. It's a little bit dated now, but some of the concepts and techniques that we use today were actually born from Kelly's book, and also the middle third fracture. Then we started jumping ahead, basically. A lot of you have read this book, yeah? Maxillofacial Injuries by Rowan Williams. A couple, again, eminent oral surgeons, although the word maxillofacial was starting to creep into nomenclature. Rowe, as you know, for his Rowe's Elevator and a few other things as well. Both of them, as you can see, they were presidents of the British Association of Oral and Maxillofacial Surgeons. So skipping ahead, we heard Peter Ward Booth's book and elegantly talked about the paper Maxillofacial Trauma and Reconstruction there. And it's a fantastic book. So we're jumping up here now. We're going ahead basically in the era. We're sort of thinking about, okay, now the word oral and maxillofacial surgery is coming into place. Now we've got mini plate fixations and stuff like that. So we're into the area of the 60s, the 70s, and then the 80s start happening. Then we start into the eminent areas of head neck reconstruction. This chap here, David Vaughan, I think he's done wonders for our specialty, not just in the UK, but I think worldwide. He grabbed the bull by the proverbial horns and was quite a feisty individual and was quite vocal in how he wanted the profession to do. And he was the one that set up the Maxillofacial Head and Neck Centre really in Liverpool, which is not far from where I work. He was started doing microvascular reconstruction, much to the angst of our plastic surgeons. You can see Adrian Sugar. Adrian Sugar was another doyen of what we call craniofacial and cleft work. Cleft work was the, again, plastic surgeons were doing them, and again it was guys like Adrian Sugar and prior to him Tony Marcus. These were the guys who sort of set cleft lip and palate surgery that maxillofacials say, well, hey, we can do it basically. So, especially, as I said, sort of World War II hospital dental services, and then we had a thing called the National Health Service, and I'll talk about that. And then we went from the British Association of Oral Surgeons, which was in '62, and then we had the British Association of Oral and Maxillofacial Surgeons in '85. A big step forward for us in the UK was the development of the National Health System. This was July 1948. Our Prime Minister, Bevan, Welshman, decided that we needed a health system that was free at the point of use, basically, to the whole population. So this was set up under a Labour government, and the idea is, you can see three things there. It covers the whole population. It's free at the point of delivery, and it's based on clinical need, not ability to pay. And you heard Keita yesterday talk about equality. This is equal, so it doesn't matter if you've got 1 rupee or 1,000,000 crore rupee, you will get treated exactly the same, whether it be trauma, whether it be oncology, whether it be any procedure at all, whether you need primary care services, you need to see a GP, you need to see a physio, you attend an A&E department, you will not be asked for 1 penny. It's all free, funded by the government. There is private healthcare, which is in a small minority and insurance-based as well. But you can see there what a typical day looks like in the NHS. And all these things that you can see here is all free. We have slightly sort of clouded the thing now because the UK, is divided up into 4 countries. Northern Ireland, we've got England, Wales, and my favourite country, Scotland, because I'm from there. So what about oral and maxillofacial surgery? Well, we were recognised as a surgical specialty, thankfully, and it was to the works of like David Vaughan, etc. in the mid-80s, and the profession then voted to possession of a medical degree mandatory for consultant appointment. And then eventually in 1994 we joined with the other 9 surgical specials of all the Royal Colleges to be a surgical specialty on its own. So now we need the dual decree, and this was it was done as a medical qualification order. You must be registered with the General Medical Council. You can be registered with the General Dental Council, because I've got a dental degree, but I choose not to. There are various reasons why I do that, but I don't practice dentistry, I practice surgery basically. There is a specialty of oral surgery, and you may well hear that in the UK. That is a completely separate specialty. Basically all that does is they take teeth out and they're pretty much in dental schools basically, and that's held by the GDC. In England, where I work, there are about 127 hospitals doing oral surgery, sort of dental alveolar work, and oral and maxillofacial surgeons. At the last count, there's less than 400 oral and maxillofacial surgeons working in the UK. There's not a lot of us, yeah? We're actually quite a select bunch. I think in Bangalore alone there's probably about 400 of you, I think, basically, yeah, the last count. So we're a small specialty, yeah? There's only less than 400. This is in England. Scotland, I think we've got about 60 or 70 at the moment, basically. What about cleft lip and palate services? Well, prior to sort of the 1990s and that, cleft was the doyen, or the sort of under the envelope of our plastic surgery colleagues, yeah? You had 57 centres throughout the UK doing cleft lip and palate, and at last count there was 87 surgeons. But in the UK we only see about 600 to 700 cases of cleft lip and palate a year, so we don't have big numbers, but you had 87 surgeons doing that. And they weren't doing them well. Some of them were maybe doing 2 or 3, and they were done by plastic surgeons. So we had a thing called the Seaside Report, and that was done in 1998, the Clinical Standards of Eye, Gluten, Cleft Lip and Palate. And they had a look at it. It was based after the Euroclef study that was done, and looked at centres in the UK and in the Scandinavian countries, and our outcomes were not great. So what they done, they decided to rationalise cleft lip and palate services in the UK post 1990-95. So as you can see, there's not actually 17 centres, there's actually 9 cleft centres in the UK. These are hub and spoke centres, but these are dedicated cleft lip and palate services offering primary repair, secondary repair, all the way up to orthodontic services, ENT services. You can see the list there. It's a huge team that goes into it. I'm glad to say now that in most of these centres, 80% of the surgeons now are oral and maxillofacial surgeons. About 5-10% are maybe plastic surgeons. You have the odd paediatric surgeon doing it, but the majority now are oral and maxillofacial surgeons. How do we look at some of the figures there? And in the UK we get about 1,200 babies a year, so it's about 1 in 700 as I said. But then I looked at India, my lord, yeah? And something between 27,000 and 33,000 cases a year. However, if you look at the incidence of it, it's 1 in 781 births, so it's roughly about the same. It's because of your population size, basically, yeah? That's why we don't see a lot of cleft lip and palate. And that's why a lot of my trainees come to India, because that's where they get to treat most cleft lip and palate. What about craniofacial services? Again, they had a look at craniofacial work. Again, the instance of craniofacial syndromic skull deformity in the UK is very, very limited. So again, in the UK, we've only got 1, 2, 3, 4, 5 dedicated craniofacial centres, basically. Deepesh is here. He spent time at one of the craniofacial centres in the UK, Oxford. So again, they rationalised all the centres, and again, about 90% of the craniofacial surgeons in the UK are oral and maxillofacial surgeons, again trained to do craniofacial surgery. And I'm just delighted to hear that one of my trainees, Aitor De Gea from the Northwest, has just been appointed craniofacial surgeon at Alderhay just last month. And I brought him out to India 2 years ago, because he'd never been to India. Taking a Spaniard to India was quite entertaining. Doubly qualified, nice guy. Mr. Edwards, can I come out to India? Yeah. So we took him to Chennai, and I took him to an IPL game. I took him to see the CSK, and trying to explain to a Spaniard the rules of cricket was almost impossible. But the T20, so we got him dressed up in a CSK shirt and gave him a whistle, and he had a whale of a time. Couldn't understand what was going on, but CSK won anyway. So what about training as an OMFS surgeon? Well, it developed out of the hospital dental services, and as I say, 1980s to 1985, the dual qualification was mandatory. So that's what you've got to go through if you want to be an OMFS surgeon in the UK. You can either do it dentally or medically. You need to do your foundation jobs, and then obviously you're at medical or dental school for 3 to 5 years. You do what we call core surgical training or core dental training, and then you have another 5, 6, 7 years as an OMFS specialist training. There are now fellowships in cleft, craniofacial, aesthetics, trauma, all that. We offer now fellowships. When I was training, there was no fellowships. The fellowships was you got on a plane and came to India, basically. That was your fellowship. And I spent some time with the Northern Cleft Foundation on their cleft clamps up in Nagpur. Had a great time there. With George Tekraswamy and the team. We used to go out for 10 days to 2 weeks. We don't have a lot of people applying for it, as you can see. There was only 32 applicants because, number one, it's a long pathway. Number two, it's very expensive. And number two, you lose your hair by the time you get to my stage. Yeah? So that's why a lot of people don't do it. So, see if you can spot me up there and amongst that. That's 1982 when I went to medical school. See if you can spot me up there. There, that's me with hair and with and with a very questionable moustache. People say I look like a Mexican hoodlum. I would tell you other things they tell me I look like as well, but that's me in 1982 when I went to dental school, with hair and a moustache and a lot slimmer as well. It took me 25 years to be a consultant. There he is. Handsome chap, isn't he? Yeah? Look at that. Ladies would love him. So, who's influenced me? Well, Professor Khurshid Moose, I think, was one of my first ones. You probably all heard about Khurshid Moose, fantastic surgeon. This was the unit in Cannisburn, initially plastics and maxillofacial surgery service. Khurshid Moose, Derek Henderson was there. Plastic surgeons Ian McGregor, IT Jackson, fantastic centre, dedicated unit, 122 beds, 5 operating theatres. As I got older on, I passed medicine, and these again were two big influences in my career. Professor John Lowry, he was based at what they call the 4Bs, Bolton, Blackburn, Bury and Burnley. That's the old Blackburn Hospital, an old Victorian hospital. Sadly, John Lowry passed on. And another great influence was Professor Bob Woodward's. He was at the North Manchester unit, and just very, very sadly, Bob passed away just last year as well. So we've lost two of my great influences. Where do I work? Well, that's the team there. I work in Preston, just outside Manchester, north of Liverpool. It's a level 1 trauma centre. It's a big unit. We do general maxillofacial services to this area, extending out as far as Blackpool, and our oncology, trauma and specialist services, except cleft and craniofacial. We cover that area right up to the Scottish borders. That's my team. Spot the odd one out, or the odd man out. Who's the odd man out? It's the white guy in the middle, isn't it? Yeah. This is my maxillofacial unit in the UK, basically. Yeah. And I'm the one with the lack of melanocytes. Yeah. Shakil Akhtar's the senior consultant. Shakil's second generation Pakistani. Kashif Fanjum's from Pakistan. He was surgical trained before he came to the UK. Done Max Vax. Some of you might recognise Padaki and Marcos. Padaki and Marcos are, as you can see, Indian. Padaki, A.B. Shetty graduate, yeah, and Marcos from Kerala, done his master's degree in Suvita. So they done BDS in India, but came to the UK, done their MD-CHB, passed their ORE exam, passed every other exam going, became my trainees, and I thought, ooh, quite like them, I've trained them well. So we appointed Pawan 5 years ago and appointed George just 2 years ago. And they're good microvascular surgeons. My eyes were getting bad, my back was getting bad, and I can't sit under the microscope for 10 hours. So I said, right, you guys are going to do all the microvascular stuff. So 4 specialist surgeons, 1 specialist trainee. We've just got an overseas clinical fellow. He's from Sri Lanka, nice guy. So hopefully we'll have another overseas one, hopefully from India this time as well, and I've got 5 juniors. We also have our dental colleagues as well, providing restorative, orthodontics, paediatric and what we call special care dentistry. As I say, we get about 5,000 referrals a year, mainly from primary care, but we get from all our surgical specialties as well. We do, you know what we do, you know, we take teeth out, yeah, well all my juniors do. We do pre-prosthetic, we do oral medicine, TM joint, facial pain, and then obviously the full gamut, oral facial malignancy with ablation reconstruction, facial deformity, not cleft and cleft palate, but we do trauma. We've got a big trauma unit there. So what about my Indian connection? You heard on day one I fell in love with India. That's me, way back, that's me lying on a hammock there. That's Mararikulam in Kerala, way back some 30 odd years ago when I was young. Look, I did still have hair then, so enjoying a fantastic tally and partaking a fantastic toddy. It was toddy in that glass, but I think they finished it. So I sort of fell in love with India then. I visited all over the place in India. Some of you recognise lots of these planes. I've experienced Indian trains at their best and at their worst. Fantastic experience for me. I've slept on an overnight sleeper from Varanasi to Delhi. I've been on the Ganges, as you can see there in Varanasi. I've been to the Taj, Khajuraho, the temples as well. I've been up north to Dharamshala. I've actually had an audience with the Dalai Lama. So what about professionally? Again, professionally I got involved in India. This is ICOMS in 2007. Some of you were maybe there in 2007. Yeah, you were there, Sonal, yeah. I presented there. It's one of my first international presentations. That is me. Again, the hair's thinning a bit and starting to go a bit greyer. This is Satish Prabhu. Satish Prabhu, another Indian chap, another one of my trainees. He went to Oxford. We couldn't poach him, so he's now a consultant in Oxford, basically, yeah. I then got involved with the Royal College, and this was a trip to Chennai we had in 2010 for the MFDS exam. You can see there my Indian colleagues, Bhaskar Rao, Ashok Ramadorai, and we also have a man who a lot of you will know who passed away some time ago as well. And the rest of the team as well were great. And that's Mohammed Al-Maraki, who I just met the other day in Dubai, believe it or not. So then as years went on, I became the director of the exam, and I took the exam team out, and again you can see some of our Indian examiners, Madhu Lakshmi. There's a young Gopal Krishna hiding in the background there, yeah, you can see young Gopal, and Wahab and Lal Matador were our examiners at the time. We had a graduation ceremony. I was a lot thinner then, as you can see. Starting to go bald, but that thing I'm wearing is a kilt. It's fine Scottish attire. It's not a man in a skirt, it's a kilt. I don't have it with me, so please don't ask me to wear it. It's too heavy and it's very bulky. So with the college, I got to do fantastic things. I was the director of exam, and then I got appointed dean, which was a great honour, and I got to travel around India meeting some fantastic people, and some fantastic people came to see me in Glasgow, as Balaji and Rajesh came to visit us, and we bestowed degrees on them. I get to operate in India, which is fantastic. So I've operated on salivary gland, orthodontic trauma. So again, I get to meet some fantastic colleagues as well and interact. I get to attend conferences, like now, and I get invited to the Association Indian, so AMSI, and fantastic last year we just had the Asian Congress, as you know, basically. And that's me pictured there with Sanjeev and Satish, myself, who were actually all trainees of Bob Woodward's, believe it or not. So it was a bit sad to see the three of us there. And of course, there's the social side. You guys are known how to party, don't you? Yeah? Wow, do you guys know how to party? These PGs can really rip it up, basically, of an evening. So there's always the banquet evening, which is fantastic. So I usually partake of a small libation, and usually end up dancing the night away with several of the PGs. India has inspirational surgeons as well, and they've inspired me in my trips in India. This obviously you all know very, very well. He was probably your first oral surgeon, probably the starter instigator of maxillofacial surgery. Keita talked as well about the fact that you guys distribute wires and things, and that you were just known as dental surgeons and stuff like that. I listened this morning to the lectures on rhinoplasty to see how far you've come in India. In 20, 30 years basically, you wouldn't have thought of you guys opening a nose up, for God's sake, and doing anything like that 20, 30 years ago. If you tried to do that, you'd be reported to the Indian Dental Council, there would be an outrage, it'd be in the Indian Times, there'd be all sorts of things. But look what we're doing now. Look what you guys are doing now. We've been there, we've seen it, we've done it, we've had the t-shirt. And you've had inspirational guys, these guys are fantastic. Some of them no longer with us, unfortunately. We lost Kishore not that long ago. But Moise Beg, I met him just last year actually. CKD again, another fantastic advert. Again, coming up to present day, again fantastic that we've now got two presidents as well, one of the Indian Association, International Association, one of the Asian Association as well. And the present day, well, these guys there, you've seen one of them, who's standing on the stage basically, yeah? Yesterday. Moni, Moni Kerala, fantastic surgeon. I learnt a lot from him. Gosler's unit in Hyderabad, now that was an eye-opener for me for the first time when I seen the amount of surgery was going on. And this man Gopal, well, he taught me how to drink whiskey basically. He taught me a few things as well, but he taught me how to drink whiskey. So So, what about you guys coming to the UK? Well, it's very difficult. You need to be registered with the GDC. If you don't have one of these degrees, it's very difficult. It's changed now as well. So what happens if you want to come to the UK? Well, we came out in Brexit, and now anybody prior to that needs to go through the system to be registered with the GDC if you're a non-EU qualified dentist, which unfortunately most people from India are. You can get temporary registration, but temporary registration is very difficult. You have restrictions, you can't do much basically, and we don't tend to employ anybody on a temporary registration now. I can't do it because I'm not registered with the GDC now. You can get these posts, SHO posts, specialist registrar, but these are all falling by the wayside now because you need to be doubly qualified, which is a bit of a shame really. The registration again is only for, you can only do it up for basically a year at a time basically, but you can renew it up to 5 years. But then after that, you're back to there, unless you want to be fully registered. You've got to sit this dreadful exam called the ORE or the LDS exam, and this allows you to be fully registered with the GDC. That's expensive, yeah. Look at these prices, yeah. And that's going up from January this 2025, just gone up to 4,819. It's two parts. There's a written part and a clinical part. I'm not going to get into it in great details. It's a horrendous exam. I would not be able to pass this exam if I sat it tomorrow. I would certainly not be able to pass it. The part one is just covers everything from clinical dentistry, law, ethics, health and safety. And these are just some of the questions, basically. They're basic anatomy type questions, but I wouldn't be able to do it, especially the last question. Which of the following best describe the change pH of blood plasma that leads a change into the Bowes shift? Remember something about that years ago. Part 2 is an OSCE, which is a clinical exam. You could probably do better than that you would at the first part, basically. The LDS is very similar. It's all run by the Faculty of Dental Surgery. Again, it's a Part 1 MCQ, applied to clinical sciences and law and ethics, exactly the same. And the Part 2 again is just an OSCE station. So the two of them are very similar, except they've got another Part 3, which is an operative dentistry part. Basically what you need to do is you need to test your skill on a dental mannequin, and that's where I'd fail miserably trying to cut a cavity these days. I would have no idea where to start and pick up a dental handpiece. But even then, even if you've got your ORE and you've got your golden ticket, you still need to register with the performers list. So for a year, you're on restricted practice, basically, and you have to do a whole lot of mandatory training. We do allow you to come in Tier 5, and that's what I was saying. I've got a Tier 5 fellow at the moment. We can get them for 2 years, and that's done through the Royal College of Surgeons, and it's a paid post, so you can come over for 2 years, learn and get paid for it. As I say, you register with the Faculty of Dental Surgery. We usually like a senior trainee rather than a junior trainee, basically. Sometimes somebody who's PG1 to probably 2 or 3, basically. There is a checklist, but I'll send you the website details if you want. You can study for a postgraduate degree, so if you want to do a master's degree, then fine, you can go and do that, but you can't work in the UK. You're on a Tier 4 visa, basically, so you can go and do a master's degree if you want at one of the universities. But even if you have that master's degree, you cannot work to practice dentistry in the UK. You still need to pass the ORE exam, so you can spend £30,000 doing a master's degree. However, what happened after COVID, we had a real problem with dentists in the UK. Dentists were just falling by the wayside. Nobody wanted to do NHS dentistry, it didn't pay. So what happened was the GDC thought, well, wait a minute, and as the Dean of a Royal College then, I actually spoke to them and say, look, you've got a workforce out in Asia who will jump at the chance to come and work here, but your restrictive practices are awful. So what they decided to do is they put in this plan in place, and they are now allowing you guys to come over and work in the UK on restricted practice, so they can actually contribute towards dental care for our patients, because there's no NHS dentist, so there is an opportunity for you. It's got to go through law, you've got to be provisional registered. I don't know the full ins and outs of it because it's still being thought through, basically, because you need government legislation to do that. In the UK, as I say, if you want to be a max fac surgeon, you can do it. You've seen guys like Padaki, you've seen guys like Marcos, you've seen guys like Satish Prabhu come over to the UK and do it. So you can do it, but you need to be dual qualified. You need to have that double degree, whether you do medicine first or surgery, dentistry first. You need to do that there, and it's 20 odd years. It's a long time. And as I say, you go grey, you lose your hair, and your figure goes as well. So it's very, very difficult for you, basically, yeah. Just because it's a surgical specialty, and all you guys are registered as dentists, basically, yeah. And we don't offer any fellowships. There are fellowships, but they're for our own trainees. You can come as an observer, but essentially that's what you'll do, is you'll observe. You won't actually do anything, which I don't think you get much out of. As I say, coming as a tier 5, that is a good option. You can apply through this, identify where you want to go, phone up the unit, and then you can find whether or not you want to come to the UK. And that's all the contact details. You want to take a screenshot of it, basically, about the different bodies that do it. It's done through the Royal College of Surgeons, but the GDC websites will give you ideas of how to get it, basically, yeah. So what about me? Well, I became this fella here. I became a Dean of a Royal College. I had no intentions to become a Dean of a Royal College. It was not in the CV. I had no idea. I sort of fell into it, yeah. And what has it allowed me to do? Well, it's allowed me to join this college. Joined in 1599. It was actually formed, and it was formed by this guy who was a famous surgeon who worked with the kings of Spain and France, came back to the UK, and formed our college in 1599. That's our faculty. Started with the executive board, ending up with me as president. I've actually come off that now. I'm an ex-dean, as they say. We're based in Glasgow, which is in Scotland, not England, just in case. England's that pink bit where I work. That's our building in Glasgow. It's not a college, it's a dental college. It has no operating rooms, it has no operating theatres, there's no dental chairs or anything like that at all. It's basically a building. We have a number of international footprint. This is India. You can see there we've got 500-600 dental fellows and members. Some of you maybe will be sitting in the audience, maybe I'll be a member and fellow. More physicians and surgeons, basically, yeah. We have international advisors. You can see there, I'm slightly biased with maxillofacial surgery with Abi and Wahab. Manu Lakshmi's now moved to the UK. Shrivastava is still here, as is Devados over in Rajeshwari. So how do you become a member or a fellow? Well, you pass an exam, or you can come through the non-examination route. You can pass the exam, you sit the MFDS, 2-part exam, and basically you get nice initials after your name and you become a member of our faculty. As I say, it's a very easy exam to pass. You guys would breeze through it. Once you'd finished your BDS, it would be no problem at all. It's not a difficult exam. There is the there is the non-examination route, and this is the meritorious route. So if you're quite, high up in your profession, you've qualified, say, been qualified for 10 years, come and see me. Send me a CV, and we can get you in through the what we call the non-examination route, and that can be either for MFDS or even our higher one, which is fellowship, basically, yeah. And that's the fellowship. Again, it's somebody who's either been a member or indeed somebody who's contributed significantly to their profession. And there's a number of you sitting in the audience here who would certainly qualify for that, and I'm more than happy to support any application. It's allowed me to go and do all the fancy things and wear the gong. We are able to go and have fantastic ceremonies. It gives you access to a shed full of money as well. All this money is available through grants, scholarships and everything. And these are all the ones purely for dental faculty. As you can see there are tens and thousands of pounds, and that's given out annually, basically, yeah? And it allows you to travel, etc., etc. So there is money there, and not everybody applies for it. As I say, what I thought about when you said Gyan, it means knowledge or wisdom, and it's very much used in Indian philosophical for spiritual meanings, and it means awareness, truth, reality, and the nature of existence, and it talks about education, which is very important, but also talks about spirituality and personal growth, and hopefully that's what this conference will imbibe to you, as well as a degree of not just the educational one, but the spirituality as well, and indeed the personal growth, and you're developing yourself personally. We're all on this sort of curve, aren't we? Yeah, we're all, I put this curve up because it talks about masters. Sonal said, there are masters here, and then there are learners and stuff like that. So that's me when I first started out. That's this handsome chap that you've seen before there. Look at that with the bow tie, yeah, and the hairstyle. Look at the hair then. That was fantastic, yeah. That was very 1980s when people had big hairdos, and I was smoking then. Bad habit, but yes, it's a cigar, you see. So this is where I was, and I don't know if I'm here yet. Yeah, I'm still learning. Yeah, every time I come out here, I learn things. I've sat here and learned lots over the last 24, 48 hours. So I'm probably further down that curve than I think. So I'm not a master. Yeah, not yet anyway. I don't think I am. Even though in time it says I am, because I've been around for a long time. Again, highlight of my career was Professor Moose. He was the first maxillofacial surgeon to be Dean of a Royal College faculty. I'm the second, so that was a great privilege for me to follow in his footsteps. So that was a highlight for me, and I have two favourite things in India, and you probably all know them. I didn't need to say it, yeah? I didn't even need to say it, yeah? You know my two favourite things. The masala dosa and Kingfisher beer. Anybody wants me to give a lecture, provide that, and that's fine. I don't charge anything apart from a masala dosa. I'm going to leave you with a scene as Gandhiji's state, and it says the best way to find yourself is to lose yourself in the service of others. That's what we're here for. We're here for our patients, aren't we? We're here to serve people. We're here to look after our patients as well. And hopefully, by attending, this series of lectures and that as well, you'll go on to inspire not just yourself, but inspire other individuals as well. Thanks very much for your attention. Thank you. Good, thanks.
Thank you very much, sir. Thank you, sir. That was fantastic. Okay, lunch.